Generally, as a firefighter paramedic, we see a good number of allergic reactions. The reason that we're in the kitchen right now is a lot of the times the offending things that cause allergic reactions would be things such as peanuts, fish, shellfish, things of that nature. We've also brought in some medications because medications primarily seem to be the source of ingestion as well. That can cause allergic reactions. The most common ones that we see are like penicillin or sulfa drugs, things of that nature. The other way that we see a lot of the allergic reactions would be like injections from like a scorpion sting, bug bite, where the venom is injected into the body. So in the city of Mesa, obviously, there's 2 EMTs, 2 paramedics on each truck. We're 4 minutes away from anything that's any type of life-threatening emergency, which would be your anaphylaxis. So we do have the ability to reverse the signs and symptoms of an anaphylactic shock if we were to encounter that. So that being said, we are the best ones equipped to deal with that. We're pretty up on it. We know what we're looking for, and we have the ability to reverse those life-threatening conditions if we see them. If they can see the red blotchy skin, if they see red raised blotches, itching, swelling, can't breathe, if you can hear wheezes coming out of them, that would be something that would be good to know. But generally, in terms of what someone can do prior to our arrival, there's really not a whole lot. If somebody has an EpiPen on hand, you could administer that if they know that they have a known allergy. Generally, people keep that on hand. But if they feel it coming on, they themselves will be able to just auto-inject that. Benadryl, if someone can breathe, they're able to take it on their own. You could administer Benadryl, get somebody some Benadryl, but if their airways are closing down, there's not a whole lot that anybody can do. The best thing to do is activate the 911 system early, and we can get there within 3 to 4 minutes, because that's how we are geographically located throughout the city. We're strategically placed to get anywhere within 3 to 4 minutes, and that's the key, is just recognizing early and calling us. The majority of snake bites that you're going to see, statistically speaking, they're on the hands and the lips. People get inebriated and they decide they're going to try and kiss the snake, or they're going to handle the snake, and that's basically what happens to people, is they get inebriated and think it's funny and they do something and they get bit. With scorpions, it's just kind of a toss-up. You're just luck of the draw. Most of the scorpion stings that we see are just localized reactions. If you do start seeing where the pupils start bouncing around their eyes, they start to salivate, start to have an altered level of consciousness, then it's definitely time to call 911. And even if you're unsure, maybe your little one gets bit by a scorpion, you're unsure, you want somebody to come check you out, we'll be more than happy to come check you out and just make sure. We'd rather go on somebody who's not having a systemic reaction, just a localized pain. We'll come out, maybe tell them to put an ice pack on it, things of that nature.